Obviously, this is a scary time for anyone who's medically impacted by the hurricane because the local hospitals are already packed full with COVID patients, which leads us to Dr. Kevin Kavanagh, retired physician and also the founder of Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
I know your thoughts and prayers are with everybody down there in the area. I'm just thinking, man, perfect storm, I guess. You've got the hospitals packed with COVID patients, this horrible storm coming through. I can't imagine how it could be much worse.
Well, simply by cramming a bunch of unvaccinated individuals into storm shelters, that's going to add to it too, unfortunately, Jack. No, it is. It's going to be a disaster, and it's something that we're going to have to mobilize forces in our hearts and everybody join together and help them get through this.
Now, I know that you were not much of a fan of the Railbird Festival over the weekend, and apparently a lot of folks were not real happy with the fact that there was a 2 to 2.5 hour wait for a drink and to get into the restrooms and all that stuff. But I know from your standpoint, you're thinking about people, close together and all that kind of stuff.
Well, that's correct. I'm very concerned about that, along with the demonstrations for voter rights up in D.C. You have all sorts of air shows going on in the state. I mean, Jack, it's just craziness. This virus doesn't care. And as we've learned, vaccination status does not prevent you from spreading the virus. And a number of people who have been vaccinated can become severely sick. Maybe not in the ICU or on the vent or dying. They could if they're immunocompromised or if they're elderly and far out from their vaccination. But in general, they still can become significantly sick with risks of long hauler syndrome. So all of this at the height of a pandemic really is questionable activity. And I know that they've said, well, they did a big type of event over in Chicago, I believe, and that this is similar, etc. Well, yeah, but you've got a month more of vaccine waning. You also have 7 times the viral load, and I did the calculations with that. And so all this put together places us at a very high risk activity. And this is at a time when we're trying to open schools safely. We should be trying to drive down community spread and viral load in the community instead of having types of events that are going to promote it.
All right, what kind of news do you have for us this morning?
Well, the big thing is, I think that they're still kind of discussing about boosters. I was listening to the interview between President Biden and also Prime Minister Bennett from Israel. And during that time, President Biden said he was going to ask Dr. Fauci on whether or not maybe they should go to 5 months out from vaccination to get a booster. And from what I can see from the news, they're going to stick with the 8-month. But for me, I think they should be, especially for the elderly individuals, getting that more closer to the 5 months out. And also, a number of schools around our state are closing, at least temporarily. And we had one tragic death out of Lee County of a very young individual who is Heather Antley, who died of COVID. And 3 others that were hospitalized, 2 on the vent. None of that is, of course, desirable, but these are frontline workers who have really risked their lives to open our schools. Personally, I think that we really need to get better protection in our schools, better masking, twice weekly testing, improving ventilation, podding of the students, and everybody vaccinated who can be vaccinated. But I think similar to President Biden talking to the troops coming overseas and meeting with families who have had frontline servicemen that have fallen in the service of our country, I think some of the leaders of rushing to open schools should really try to reach out and contact these families that have been lost to this disease and try to console them and to, explain their reasoning on how come rushing to open schools without proper preparation was so important.
Hang on there just a second. Is it all right if we take a call or two here?
It sure is, yes.
All right. David, thanks for holding, David.
Why do they keep harping on the vaccines and everybody become vaccinated if the vaccines do not prevent you from getting COVID, even though it might lessen the degree.
Yeah,
the natural immunity will keep you as well as anything else. He keeps harping on Biden. Biden, the poor fellow, doesn't even know where he's at.
Okay, well, let me hop in there and explain and explain this. And I think this is important. When you talk about natural immunity and the vaccines and stating that, well, that'll be just as good as the vaccines, even if you accept that, neither is good enough with the Delta variant, which is why you need to wear masks. And the other thing, which I think is people need to realize, it's not about you, okay? If the vaccine, let's say, decreases your chances of getting an infection by 50%, that also means you're decreasing your chance of spreading it to someone else by 50%, and it starts to give community protection. Now, is 50% enough protection for an individual to go out in a high viral setting? Probably not. You're going to need to wear other things, such as a mask, or you're going to need to get into proper ventilated setting. So it is very important to use it as a shield of armor, but we need to get away from this thinking of me, and look at community spread and trying to decrease viral load in the community. Even if we had a vaccine that was 90% effective, 90%, which is excellent, in high viral load settings, that's not adequate protection for the person who has the vaccine. But if everybody took that vaccine and you drove down the virus load in the community, it then becomes very unlikely for that person to encounter the virus, and if they did, the vaccine would work. So the only way vaccines work is if everybody buys into them. And this is what happened with the measles vaccine. This is what happened with the smallpox vaccine, with the polio vaccine. The vast majority of people bought into them. On the measles and also on the polio, over 90% of the kids are vaccinated. This what gives you the community shield, then the added protection of the vaccine. But if only 50% of the people become vaccinated, it's not going to work. And believe me, we are facing down other variants which will produce another surge and another round of reinfections. So we really need to start to take this seriously.
Let me add, even if you want to be selfish about it and make it a me situation, by getting the vaccine, you could potentially get the virus, but the chance of you actually having a serious event as a result of it is much less. So even if you just want to look at it from a selfish standpoint, getting the vaccine helps you because, like I say, you're probably not going to end up on a ventilator. If you don't get the vaccine, the chances if you get the virus, it could be, depending on who you are and your health and all that, you could die from it. People are dying from it every day.
That's correct. And I have now 5 friends who have close relatives, sometimes their children, that have died of this disease. And through my entire life, I cannot even remember having a close friend that had someone who died of flu. This is not the flu. It is a dangerous virus, and this will be one of many waves that we're going to encounter unless we join together as a community and snuff this thing out. Extremely important to do.
All right. As always, a pleasure, Dr. Kevin Kavanagh. Thank you so much.
All right. Thank you very much. I appreciate it.